Good afternoon, everyone. Thank you so much for being here on time today. We do have a large group registered to join today's training, so we're going to give it just a couple more minutes to allow others to get logged in and get settled into the WebEx space. So we'll start at 1:03. For those of you that just joined, we are going to give it a couple more minutes, so we'll get started at 1:03. All right, it is 1:03. We're going to go ahead and get started today. It looks like our lobby has slowed down. I'm just going to start off with my disclaimer letting you know that today's presentation is being recorded for internal training purposes only and may be available to the public at a later date. So let me welcome everybody to our today's training, our Applied Behavior Analysis ABA workshop for Provider Type 85. My name is Susan Harrison, and I'll be hosting today's ABA workshop. Joining me is Ashley Papez. We are both field representatives with Gainwell Technologies, who is the fiscal agent for Nevada Medicaid. Thank you for taking the time to join us today. We genuinely appreciate your participation. It doesn't look like we have any policy people here today or medical management, so we'll go ahead and bypass introductions for them. We are scheduled for 90 minutes, so I do ask that you please take time to check your space and remove any distractions so that you are present for today's training. A few reminders and expectations for today. Your cameras are off, so you don't have an option to go on video. Your mics are muted for you right now, but if we do ask for you to come off of mute, you can go ahead and come off mute and elaborate on a question or whatever it is that we ask for you to do. Today's training is for fee-for-service only and not managed care or MCOs. And then if we do run out of time for me to address questions as they come in through the chat, we'll take time at the end to address any of those detailed questions if we need to. So before we get started, I'm going to ask if everybody knows how to use any of the WebEx tools. You'll see them here on this next slide. We will be having some engagement today. So the first thing I want you to do is just if you know how to use any of the WebEx tools or any of the reaction tools, if you've used them in the past, can you click the reaction icon at the bottom and give me a thumbs up? Perfect. All right, so the other engagement tools that we're going to be using, we talked about mute, unmute, and video. We have the raise hand function that's in your darker purple box down here with the little hand. If I ask you to give me a hand raise or you want to raise your hand to get our attention, you can certainly click that. If you click it once, it'll raise it. If you click it again, it'll lower it. Then you have your reaction icon right next to that in the lighter purple. And then you have your orange box with your menu or your options feature. If you need to adjust your settings for any reason, you can go ahead and click on that. It gives you more options. And then if you, for whatever reason, you need to leave the meeting before it's over, you can click that red circle. And if you have time to join before it's over, you can just join using the link that you used to log into the meeting today. Moving over all the way to the right, you have a red circle or a red square around your chat feature. If you haven't already opened that, could you please take a moment to do so now? We are going to be using chat for some of our engagement and for you to ask questions as we go through our training. So if you come up with a question and I'm presenting and going through something and you want to make sure that your question gets addressed or answered before you forget to ask it at the end, you can go ahead and pop those in there in the chat and we will monitor those as we go through. Back up a little tiny bit to the green square with the S, that's a Skittle looking thing. That is our Slido app. We do use that for polls and surveys. It will be used today. We'll launch some surveys for you, or Ashley will, and we will use that to answer all of our responses in or put our responses in. Those responses are anonymous. Let's see. Okay, so I do encourage you to ask questions, making sure that you don't forget to ask any of those. I will try and stop and answer them as we go throughout training. But like I said, if we run out of time and time runs short, we will answer those detailed ones at the end. So if you've been to any of my workshops in the past, you may remember that I tried to cram a whole bunch of information into an hour and a half, kind of like fitting a week's worth of groceries into a bag and hoping it doesn't rip. It was a lot. So today we're going to slow down just a little bit and focus on just a few key topics so that it actually sticks with you. If anybody has been to my trainings in the past, could you just raise your hand for me just so I can make sure that I have who I have on the phone today or on our call today? Lele, thank you. Christina, thank you. Great, welcome back. So again, we will be doing this just a little bit different today. So before we jump into the content, let's just do a quick snapshot of where everybody is at. I'm going to ask that Ashley launches the first Slido that will appear on the right-hand side of your WebEx page. You don't have to do anything different other than just put your responses into the Slido app. I will go ahead and share that information, the responses on my screen. Okay, Ashley, take it away.
Thank you so much, Susan. So for our first interaction today, this is a multiple choice. So the first is, how comfortable are you with locating relevant resources? 1 being not comfortable, 2 somewhat comfortable, and 3 very comfortable. Feel free to answer in the Slido. If for any reason you can't, please feel free to post the answer in the chat. And Susan, we do have some answers coming in. It looks like the majority is marking themselves at 2, somewhat comfortable.
Perfect, thank you so much. So we'll go ahead and jump right into the next question here.
Right, and then the next question, it is a word cloud, so you can free enter your answers directly into the Slido or the chat. And this is going to be, what resources do you currently use, or where do you usually look for information?
And you can put in more than one response if you use multiple resources. And I just want to call out that this mouse is adorable. I think it's a mouse. I love the 6-7 on his behind. Lele, thank you. I see that you usually call.
And we do have some answers entered, Susan. So it looks like we have the Medicaid provider portal on the Medicaid site as another option, supervisor / coworkers, on home, so the Medicaid homepage again, and the provider web portal.
Perfect. And it looks like we have also somebody else also calls as well. So thank you very much for participating in that. Ashley, if you want to go ahead and take that down, that would be great. We're going to go back to the slide deck and look at our objectives for today. So some of the things we're going to be looking at is locating those valuable resources, navigating the websites and figuring out where to find information. We're going to look at the pre-training survey results. We'll talk about common trends and issues, and then at the very end, we'll have you complete a provider workshop survey and have our live Q&A for any questions that didn't get answered throughout the training. So next we're going to talk about the survey results. So I did send out that pre-training survey asking for feedback on things that you wanted to talk about. During today's workshop, I did build the agenda based on these results. So the number one, as you can see in big orange, was our authorizations. Multiple things went into that category, so we're going to talk about some of those today. 65% of you thought that that was going to be the biggest key information topic that we could talk about today. And then running second, as in a tie, we have our billing and claims in our enrollment. And then there was a legislative session question that I do not have the answer for. So if that person is on the call, I can always use that, take it away as an action item for myself. But so this is our survey results. So thank you for those who gave their feedback. I do appreciate those responses. It kind of helps me target what we wanted to look at and talk about today. All right. So we're going to head out to the Nevada Medicaid website and start looking at those resources. So going out to our Medicaid homepage, that's our medicaid.nb.gov. It looks like Lillet for sure. Some of the people on in the Slido responses indicated that they go out to the Medicaid homepage for their resources. So we are going to talk about how to get a hold of Medicaid. I know some of you said you call. So if you wanted to find out where you need to call and what those phone numbers are, you can always go out here and click on this Contact Us at the top of this web page. And once you click there, it's going to give you like a table of contents. All of these items under the table of contents are hyperlinked, so you can go directly to that section without having to scroll all the way down the page. And I'm just going to highlight a couple of areas here. So if you needed to get for basic questions, basic information, you can contact the Gainwell Contact Center. We should be able to give you like claim status, provider enrollment status, authorization status, not detailed authorization status. That would be our prior authorization department, which we'll go to that here in just a moment. But so if you scroll down, you'll also see that the contact center is the first one here. So it's going to match up, however, it is in order at the table of contents. If we wanted to call our prior authorization team to get detailed information regarding an authorization denial or status, that number is right here for you. And pharmacy, if you had a pharmacy question, which I don't think any of our ABA providers use pharmacy. I'm just going to scroll down a little bit here to the third party identification and recovery section. This is for TPL, which hopefully everybody understands that TPL in Medicaid language means that there's another payer that is primary, or another payer is a resource is primary. That could be private insurance, it could be Medicare, it could be subrogation, it could be any number of insurance carrier types. So if you have a situation where you have a person who is just becoming eligible for another insurance, but they also have Medicaid, you as the provider can contact this HMS or health management systems. They are our third-party vendor, and they will update the recipient's record with that information so that claims will process correctly, and you don't have to always manually enter in that information if they're primary. Keeping in mind that anytime there is a TPL present, you do have to bill them for a payment or denial before you can bill Medicaid as secondary. So here's their contact information here. And I'm going to scroll up to the top using my scroll option here, and so it's going to go fast, so I apologize. But they're down here on towards the very bottom of that table of contents. So there's our contact us. The next thing we're going to look at is some of our web announcements that are key for all providers and specific to PT85 as well. So if I wanted to find all of my web announcements, I would scroll down just a little bit on the left-hand side, and I can see there's an option to view all web announcements. So if you want to look at everything back to 2003, I think is how far back it goes, or 2006, you just click this view all web announcements. Before I get too involved in this, is there anybody here that has used web announcements for information? If you have, can you type yes or no in the chat? You're looking for information. Do you ever refer out to the web announcements? Awesome. So y'all know where to find your information in web announcements. I'm sure y'all know how to search. But just for today, we're going to talk about some of the things that have come up either in survey responses or when it comes across my desk or questions from our providers. There is a web announcement 3609, and I'll have Ashley put that link in the chat. I'm just going to search for it here because I think this is super important to go through this information. You can type your web announcement number up in your Control F feature. That'll find that web announcement specifically. This is a reminder for medical record documentation. I see several providers will reach out to me and say, hey, I just got a technical denial because my documentation didn't meet the standards or the requirements per policy. So I'm going to open this up so we can see what that looks like. It's not a new policy. It's been out there for quite some time. We just want to make sure that we are adhering to that and following all of the criteria for the Medicaid program. So in section 103.13 of chapter 100, it talks about the medical documentation requirements for anything that's attached or anything that's Medicaid related. So if you're going to attach it to a authorization request, if you have a claim that requires documentation, you're going to have to make sure that you're following all of these criteria. So you want to make sure that if you have a document that is multiple pages, that you have a page number on each one of those pages. If you have a document that doesn't have the recipient's name or date of service or requested date, that you want to make sure that you have that information added to that document. You also want to make sure that the information is legible. So if you have, let's just say you have a form that is not in the new format that already populates the name and the date of service or request date on each page for you. An FA11F is a great example. If they're on an old form and they've had it signed before by a diagnosing provider, but it's an old format, then it's missing the recipient's name and the date of service or request date on page 2. You could handwrite that information on that page 2. And you can also add page 2 at the bottom or wherever you're going to add it so that we know that it's one of 2 pages or 2 of 2 pages. So it's important to make sure that you are including all of this information on those documents when you're uploading them to the authorization. And it does say here that it is part of the prior authorization requests and approvals that you have to follow this criteria. So those are the 3 things that I can tell you: page numbers, recipient name, and date of service or request date has to be on all of those pages. And I don't know if everybody's noticed already, but on our FA forms, our FA11, FA11E, F, our FA29s, all of those FA forms have that information on each page. So if you populate it on page 1, it's going to carry through to the rest of the document. So important to follow that. And then the web announcement 3679, that was just the reminder that all of our FA forms were updated to meet the criteria. I'm going to go ahead and just pull up a form quickly and show you what I'm talking about. I'm sure you all have seen it, but just for visual sake, I'm going to go ahead and pull one up here. So here's your FA11E. If I populate information, oh, I've been on this form before. If I populate information here, it's going to carry through on each one of my following pages. So here's your request date on page 2, and so on. Request date on page 3. So that's how that works. So just make sure that you have this information on your forms. If you don't, please handwrite it. You are not altering a original document if it's a copy of somebody else's records, or if it's a copy of an IEP. That's not altering that document. It is adding to a copy, so it wouldn't be considered altering that document. So just want to make sure that that's clear for everybody. All right, so before we move forward, I'm going to go ahead and ask anybody. This is a provider enrollment question, so if anybody has had an issue or challenge with linking or unlinking providers, can you type the word linking in the chat for me? If anybody's had any issues trying to link or unlink a provider from your group. All right, so we do have some responses in there. It looks like we've had a couple of people with with linking or unlinking challenges. So the first thing I'm going to do is I'm going to talk to you about how do we make that happen? How do we make that work? So I'm going to go over to the provider enrollment page, and that is going to be hovering over the word providers in the blue toolbar, and then using the provider enrollment drop-down option. On this page, you're going to find information about new providers, what they need to have for requirements to enroll. It gives you information about what provider types we have, who can link to who, and if you wanted detailed information on any of the, Lily, thank you for your comedy. That's funny. It's not funny. I know it's not funny. I know it's frustrating, but so part of the linking or unlinking challenges is if you have a new provider that is not enrolled, you're going to link them through their individual application when they submit that, right? You're going to add your group as the linking group on that application when they submit that application. When they're approved, they will be linked to your group. If you have somebody who's on your group and you want them unlinked, you're going to have to submit a provider update or an update provider request through your provider portal for the group, and you're going to remove them from your associated provider section. So I'm going to demonstrate that here quickly for you. I don't think this shouldn't take too much time, but if you wanted to go to your portal, you can click this blue box here on this page, or you can always access it the way I normally do, would be to use this drop down up here and then click on provider login. I don't have a live account, so I do have a training account. You're welcome, Lily. I do have a training account that we're going to use today for our demonstration purposes. So I'm going to go directly to Provider Flex because I can't get there through my portal. But if you go through your portal and you do an update provider, it's going to redirect you to Provider Flex where you can continue that update. Let me get logged in quickly here. I do have an active group ATN or application where we can go in and look at how to link and unlink. So when you are launching your update provider through your provider portal and you get redirected to Provider Flex here, it's going to take you to a screen that'll say application is ready, and then you're just going to click continue. It'll take you into that group provider record so that you can make those changes to that record. Any other changes that you would need to make while you're in there, I would go ahead and do them at the same time. If you are linking somebody and you need to maybe update your business license, you can do all of that at the same time, and it'll go through on the same request. So I'm going to go ahead and use Fruits Inc. He is in an incomplete status, so I can still make changes to this application. When you open yours from the portal, again, it'll say application ready, and you'll just click continue. It will take you to this first section, provider information. It's very slow, so I apologize for that. So in the provider information section, you're going to enter all of your business license information, your W-9. If you needed to update any of this information here, you could do that at the same time here. So I'm going to go directly to my associated providers because that's where the linking and unlinking magic happens. I do have Pink Lady. She's already linked. If I wanted her to be removed, I'm just going to click the actions column and click remove. I would need to add another provider though, because you do have to have at least one provider associated to your group. So I could add, Gilbert Gala is who my other guy was. Let me just pull up his NPI. Okay. That's the right NPI there. Oops. Fill in his information. So this is how you would link a new provider who is enrolled, but they're new to your agency. You would just go in and add their information here. And then it's going to populate that information here for you. Now, what's going to happen when you link those providers is you do need to indicate that individual provider's email address because they are going to be part of the DocuSign process when that happens. I don't know if I'm getting an error or not. It's not adding. And I don't see any errors here. Try it again. Okay, well, it's not going to add it. I'm not sure why, but I won't spend too much time on it. So just make sure that this email address belongs to the linking provider so that they can get that email when it comes out to them, because they are going to be required to sign as a new provider. Again, removes them, adding adds them. Once you continue through the application and e-sign and submit it, then once that application is approved, that individual will be linked. Hopefully that clears up any confusion as far as linking and unlinking providers. Again, a reminder that any other update or demographic update or revalidation needs to go ahead and go through the provider portal to initiate the application in Provider Flex. All new providers enrollments go directly to Flex. You can bypass the provider portal. I do see a question from Danielle asking how long does it take for a linked provider newly added to become linked? That can vary. It just depends on if there's other changes that are made on the application. So the information has to be verified or validated through our enrollment team. So it can vary. I don't have a hard date or hard time frame for that. I would just continue to follow that status on your dashboard in the Provider Flex portal. Once you create that application in your provider portal and it's already saved out there in Flex, you can just bypass the portal and go back to the Flex dashboard and follow that status as it goes through the processes. So I wish, you're welcome. I wish I could give you a hard stop in, but I just don't have that. All right, so let me get save and finish later. We'll get out of here. So that's the enrollment information that came back on the survey, was asking questions about how to link or unlink. All right, so the next thing we're going to do is we're going to go head out to the billing manual on the on the billing information page of the Medicaid website. So from the Medicaid website, I'm going to hover over providers and select billing information. We're going to go through a couple of the chapters in the billing manual. And I'm just going to click on the hyperlink here to open that document. Go to my very top here. So this, kind of like our table of contents for the Contact Us, is also hyperlinked. Let me get to the table of contents page. All right, so you can hover over your mouse over any of the sections and it'll take you directly to that section, which is what we're going to do today. We're going to cover Chapter 3, Chapter 4, and Chapter 8. So Chapter 3 talks about recipient eligibility and managed care. It's really important that you are verifying eligibility for each one of the recipients that you still treat or are treating every month. So at the beginning of each month, you're verifying that eligibility before services are provided. What's happening now, especially with statewide managed care, is some of these individuals are transferring from MCO to fee-for-service or vice versa. Just depends on what their benefit is as far as their eligibility goes. So it's important to make sure that you are verifying that eligibility every month. And it's best to do it at the beginning of the month because any services or changes that were made are usually done the previous month and then made effective the first of the following month. So hopefully that's being done. If you are doing that, can you go ahead and just give me a thumbs up in the reaction tool? Great. Thank you so much. I'm glad that you guys are doing that. It's super important. It makes so that you don't get technical denials or get kickbacks saying that something's not eligible or you're outside of time frame. So that's our Chapter 3 eligibility. If you needed information on what those benefits might look like, you can always click here and go through those benefits to see what they mean. And you can also find TPL information in your recipient eligibility feature in the portal. So if there's other insurance on file, you can find that information there as well. Chapter 4 talks about prior authorizations, and that is our biggest feedback topic, as we saw in that results slide. So we're going to go ahead and we're going to talk about adverse determinations. So I'm going to click to Chapter 4. And then the first thing I'm going to do is I'm going to scroll down to, we all know how to request authorizations. Down here it talks about submission deadlines. So that's important to follow this. Our submission deadlines for PT 85 are not necessarily listed in the billing manual. However, they are listed on your PT 85 billing guide. Very, very important that you are following that criteria. You will get a technical denial or I think they just technically deny them now, where if you're not submitting it within the time frame allowed, it's being returned back to you as a denial. So, and then you just have to fix the dates of service on your FA11E form and in the portal. So you'd have to create a whole new request if you get denied for not submitting within the requested time frame. So let me scroll down to continued stay requests. So we hopefully know that for an initial authorization request, that's for somebody who's just coming to your agency, brand new, you have not seen them before, or they've discharged from your program previously and they are returning. That would still be considered an initial request. The initial requests do require that you have the FA11E and an FA11F. It has to be signed by that diagnosing provider on that form. We talked about the old versions. They are accepted, but they have to meet the criteria for documentation. So you may have to modify by handwriting some of the information on there. For continued stay requests, those are going to be for services that are continuing from an initial or from a previous continued stay request. You have somebody who's got ongoing treatment. You still need to have the services authorized. So you want to make sure that for your continued service, you're doing that on an FA11E and you're submitting that prior to the last authorized date of your current authorization period. So you can submit it up to 5 to 15 days prior to that last authorized date, but for sure no later than the very last authorized date. You want to make sure that it's submitted in time to where you get that approval in place before the first date of that continued service request. So if you expire on April 30th and your next service date will be May 1st, you want to make sure you're getting that submitted prior to April 30th so that when May 1st comes around, you have an approved authorization in place so that you can bill for your services and continue on with those services. Continued stay request. There is no grace period for a continued stay request. So if you submit it on April 30th for a May 1st date and you get it returned or technically denied, you can't go back to May 1st to request that start date. You would have to use it for the day that you are submitting that request. So there could be a gap in services or a gap in dates, and there's no way to go back and recover those dates. So it's really, really important that you get that in place and approved before that date actually happens. All right, if you happen to get an adverse determination, let's see here, an adverse determination meaning it was a denial for medical necessity or it was reduced units, you have an opportunity, I'm going to just scroll forward a little bit here. You have an opportunity to do a peer-to-peer review or a reconsideration request. Peer-to-peer reviews are due within, you have to request that within 10 days of that adverse determination date. You can request a conversation with the actual reviewer, the medical or clinical reviewer that made that determination. You would need to have a clinical person on the phone doing that phone conversation back and forth. You want to, and those are for if you have to ask questions about why was it denied. You're just trying to understand why it was denied, what you need to do to get the request approved. So it's just having that conversation with the reviewers to determine what was needed to make that happen or why the decision was made to reduce it or whatever that conversation is going to look like. But you want to make sure that it's a clinical person because they'll be talking to a clinical person on the phone. That's 10 days from that adverse determination. You also have an opportunity to request a reconsideration of the determination. Reconsiderations are going to be done within that 180-day period for ABA providers that was listed on your original request. So if you requested from May 1st to November 30th, you can do your reconsideration request anytime between those dates. So they give you quite a bit of time. And I think the reason that this was done this way is because that FA11F, if you need to get a diagnosis for your individual recipient, sometimes there was a waiting list that was quite lengthy. So we wanted to make sure that to allow enough time for that diagnosis to happen if that's the reason for your prior authorization denial. So if it was denied for medical necessity because you didn't have that FA11F completed, then that would allow for time to get that hopefully get a new form for that recipient and you could resubmit that request as a reconsideration and not lose those days. Peer-to-peers and reconsiderations do not cancel each other out. There are two separate instances, so you can do your peer-to-peer within 10 days, and then that reconsideration could be within the 180 days. So you have those two separate timelines there. Okay, so let's see. An important reminder, again, peer-to-peer, 10 days, you would have to email our nvpeer_2_peer@Gamewell Technologies. You can't see the underscore in the manual here, but those are two underscores in between nvpeer2 and peer. So that's the email address to request that. Reconsiderations you would do on an FA29B form. That's listed here for you. That does have to be uploaded through the file exchange in the portal. So you want to make sure you're filling out your FA29B form accurately and then uploading that and any additional new documentation or updated documentation to support the request for the reconsideration. Those are going to be reviewed within 30 calendar days. We would let you, no, I'm sorry. Yes, it is 30 calendar days. So we would let you know the determination of that reconsideration within 30 calendar days of the submission. All right. So in that reconsideration, you want to make sure that you're just giving a synopsis of the reason for the request. Like I said, if you got information from your peer-to-peer conversation, you want to make sure to include that documentation with that reconsideration request. All right, so our next engagement question is going to be a true or false question, and you can just put your responses in the chat. So true or false, peer-to-peer replaces reconsiderations. Peer-to-peer replaces a reconsideration, true or false? That's awesome. So everybody's saying false. That is absolutely the correct answer. Thank you so much for being with me today and paying attention to what we're talking about. I appreciate that so much. Okay, so the next thing we're going to talk about here, we're going to go back up a little bit and talk about some of these changes that you can make to an approved request. So if you get your authorization approved and you need to make some changes to it because your patient's or your recipient's condition changed, you need to ask for additional units on a certain service, or you need to ask for a new service. You may request that information. It's called an unscheduled revision. That is still submitted on an FA11E form with the unscheduled revision process type marked at the top of page 1. That is when you need to, like I said, you need to increase your level of care, or you need to increase your units. You do need to only ask for the services that you're requesting in addition to the already approved request. So if you have 97153 approved for 3,000 units and you need to add an additional 400, you're only going to ask for that 400 units on your unscheduled revision form. You need to justify why you need the additional 400 units in summary form, just like you would when you're filling out a new request. And you're only asking for those services. You need to make sure that the amount of time that's left for the current approved period will match the number of units that you're requesting. So if you are going to, this one's going to expire in 2 weeks and you're asking for 400 units of a specific code, and there's no way you can get 400 units done in 2 weeks, that's going to be the wrong amount to be asking for. You want to make sure that what you're asking for is suited for the time remaining on the authorization request. So your start date would change, but your end date is going to still be what the approved period original end date was. I know that's kind of confusing, so hopefully that made sense how I said it. I don't see any questions coming through in the chat about it, so I'm hoping that that made sense. So that is called an unscheduled revision if you are doing a modification to a current authorization that is clinically related. If it's non-clinical, let's just say you have a data correction that you need to make, you can do that on a FA29 data correction form for that approved authorization period. If you needed to correct, one great example that I can say is the modifier UD. So a lot of providers will ask for 97153 and not ask for the UD modifier on their prior authorization request. So they're getting 97153 approved without a UD. Well, now you've got no way to bill for your RBT services. So you already have 97153 approved for a certain number of units. You just need to move some of those units to align with that modifier UD attached to the 97153. So you can take existing units that you have and break those out into 2 lines if you need to, or you can move all your units that are still left by doing an FA29 data correction form. You're going to indicate on that form transferring units from 97153 to 97153-UD, and then put out whatever dates of service that's going to apply to. If you don't have the the 97153 with the UD on your current authorization approval, you need to add that line item when you're doing your data correction request. So you want to make sure that your new request that you're asking for is also part of that prior authorization. If you just need to transfer units for, or maybe you have a situation where you need to, here's a good example. If your person is going to discharge from your program prior to that end date of that authorization period, that's also a data correction form. So that's your FA29. So your person is scheduled to end that authorization period on June 30th, but they're discharging from your program on May 31st. You could do it FA29 and just change your end date to May 31st and indicate why. They're leaving the program, they're discharging from the program. So that would be a non-clinical data correction. So those are the 2 scenarios. If you need to move data around or you need to terminate them from your program. We do have a question here from Victoria. Do we include the existing auth number on the unscheduled revision request? Will they assign a new number? So you will upload that the unscheduled revision form, your FA11E, you'll upload that form directly to the authorization that's currently active and approved. So you're just going to upload it to that authorization. They will see that it's attached to that authorization number and review it accordingly. So no, it will not get assigned a new number. You're going to edit the current authorization that's in place and attach that form. So for your, we're backtracking a little bit here. I just want to kind of cover some of the best practices for using our FA forms. And we are going to have a slide about that towards the end. So for our initial request for services, the forms that you're going to need for that is going to be your FA11E and FA11F for initial requests only. If that individual that you're treating is on an IEP, you also want to include that IEP documentation. And if you have a FA11F that is talking about DSM-5 as the criteria for the diagnosis, you also need to include that diagnostic report from the diagnosing provider. So those would be the 4 forms for an initial request if the last 2 applied. If your IEP was applicable or your DSM was your diagnostic tool, then you would need the report. Otherwise, initial requests are only FA11E and FA11F. Continued service requests are going to be the FA11E, an IEP if applicable, and just that. So just the FA11E and IEP. Unscheduled revisions is going to be your FA11E and only that document. So you want to make sure that you're justifying what you're asking for, like we talked about, and the time frame is appropriate. For terminating services, we just talked about this one. So that's your FA29. Or if you need to make a data correction, that's just your FA29. Those you will indicate what prior authorization number it's affecting, and you'll also edit and upload that FA29 to that current authorization number in the portal. If you have a situation where you are taking a recipient from another agency and that other agency has an open authorization that would overlap your dates of service, you can use the FA29A form. That form needs to include that current provider of care and what services they were approved for and the last day that the services should be approved for, and we will end date their prior authorization so that you can submit yours. The FA29A should be submitted along with your initial request for your FA11E, your FA11F, so it would go along with that. That's only for certain situations where you're taking a situation from a recipient from another agency, not taking their transitioning care. If you're not sure who that provider of service is, you can contact our prior authorization department and they will release that information to you. You're going to have to work with either the recipient, the guardian, or the other agency as to what services were approved so you can make sure that you're documenting those services correctly so we end date them correctly. It's really important that you have it exactly so that it matches exactly. Otherwise, we will kick it back and say it doesn't match, and then you'll get a technical denial. All right, we have a couple of questions coming through here in the chat. Let's see. Ashley, thank you for answering that question about do we include the existing authorization number? Unscheduled revision is uploaded directly to the existing approved authorization. So yes, that's great. And then Jason, you're asking, can you submit an FA11E before that auth is over with other ABA providers? As long as your dates of service don't overlap with that other provider's authorization, yes, you can submit it, but services would have to be following that and the end date of that other prior authorization that's in place. Hope that made sense. All right, and let's see, Jason, additionally, you say their services end May 16th and the submitting, and yes, and you would be submitting for May 17th. Yes, that would be appropriate. You would not need an FA29A form for that situation. All right, so we are going to go and do another engagement quickly through using the chat. If you are continuing services with no changes, if you're requesting a continuation of services, what form would you use for that continuation? You can put your answers directly into the chat. Looks like we have a couple of responses here so far, and it looks like everybody's answering the question correctly. So that's awesome. Thank you so much. Let's go back to our billing manual, and we're going to look at Chapter 8 quickly. So let me go back up to my table of contents just because it's easier for me to just click that section. Sorry for the scrolling. I know that's kind of ugly to watch. I'm almost here. Okay. So chapter 8 is about claims and appeals. So we're going to go ahead and click on chapter 8 here. All right. So claims timely filing. That is 180 days from the date of service or date of decision for eligibility. You can find that information in the billing manual itself. One important piece that I want to bring up for you when you are submitting those claims, and we just had this happen with one of our other provider types, there was a rate adjustment. And so this provider, a couple of, well, probably several of you providers are billing for the fee schedule when you're billing your claim. So if you have 97153 that's payable at 1310 a unit, you're billing 1310 a unit, but then there's a rate increase and it jumps up to $15. You would not be eligible for that additional reimbursement because you're billing only at the fee service or fee schedule. We can never pay more than bill charges. So you want to make sure that if you're not billing at your usual and customary rate or the usual and customary rate for the service, that you maybe look into that because it is per policy that you are supposed to bill a usual and customary rate for the service, not necessarily the fee schedule. And that is specifically important when there's that rate adjustment or rate increase. You want to make sure that you're eligible to receive that additional reimbursement if services are adjusted and the rates are adjusted. I just happened to some of our other behavioral health providers where they were billing the fee schedule, and so they didn't qualify for the additional rate increase when the recycles happened. So I just wanted to bring that up, make sure that everybody understands what that means. If you have questions about what the usual and customary looks like, you can find the information in the Medicaid Services Manual, Chapter 100, and that's going to be in Section 105. I will put that information in the chat for you. So after today's training, you can go back through and kind of review that section and just see what that looks like and what it means. So it is MSM Chapter 100. All right. Okay. UD modifier, we kind of talked about that a little bit with the prior authorizations. It's important to note that when you have a prior authorization, those services that you requested, including modifiers, needs to match what's going to be on your claim. So if you are billing a 97153 UD on your claim, but you don't have an approved authorization with that code and modifier, that claim will deny. So it's important to make sure that your authorization requests are accurate so that when you bill your claims, those match and your reimbursement will come out accordingly based on how you're submitting that information. You do have to make sure that you're submitting your claims with an eligible diagnosis. That information can be found in MSM 3700. There's two distinct oh, thank you, Ashley. There's two distinct diagnosis codes, and then there's other conditions for which ABA is recognized as medically necessary that may be appropriate. You do have to have that authorization approval in place before you can bill for any other diagnosis code as well. Date span billing is not allowed. So if you are doing a service on 3 times a week and it's all the same service and the same number of units, you still have to report on your claim each distinct date of service on one line. You cannot do one line that has 3 dates of service with all of the combined charges and units. It's important to remember that because the service limitations won't calculate correctly and you could run into issues with claim denials. So it's important to make sure you're reporting each date of service on its own line. You also want to make sure that you're reviewing your covered services and service limitations grid. So I'm going to jump out of chapter 8 here. Let me just see if there was anything more important that I wanted to talk about in here. I think appeals is really what I wanted to talk about here. Before I go to the billing guide, let's talk about claim denials and the appeals. So if you get a claim denial, you want to make sure, if you're going to appeal it, you want to make sure that you're using the FA90 form to submit that appeal electronically through the portal. That goes in as a, oh my gosh, I can't think of what the word is. It's a secure correspondence. Sorry. Yes, thank you. Thank you for
You got
trying
it.
to jump in there. Secure correspondence request for any appeals that you want to appeal a denied or reduced claim. Fill out your FA90 form for each ICN or claim number that you want to appeal with justification as to what your appeal is regarding. You want to make sure that you have that documented on your FA90. If you're going to resubmit a denied claim because you found that you made an error on that denied claim, you would resubmit that as a brand new claim. It does not get submitted as an adjustment or a void. You cannot do an adjustment or a void on a denied claim through the portal. However, I know that trading partners do allow that. So one of the highest claim denial reasons for our provider type 85 community is that they're submitting a denial as an adjustment. So it must be through your EHR or through your trading partner or clearinghouse. You cannot adjust a denied claim or void a denied claim. You have to resubmit it as a brand new, fresh claim, fixing the errors that were from the previous denial. So I want to make sure and talk about that. Adjustments and voids can be adjusted on a paid claim. So those adjustments and voids do need to be submitted within that stale date period or the timely filing period that I mentioned earlier. They do not apply to suspended or denied claims. You wouldn't even have an option if you're going through the portal to adjust a denied claim. So only paid claims can be adjusted or voided. All right, I think that was it for our billing manual. I'm going to hop over to the billing guideline for provider type 85. That's on down the page a little further under billing guide by provider type. We'll pull open that PT85 billing guide. This is where you're going to find information about your authorization requirements and the timelines for submitting those authorizations. So super important to make sure that you are reading through this guideline. If you haven't already, I would definitely take a minute to know what's in here. So your request timelines are listed right here for your initial, oops, sorry about that. Your initial requests, if I could get that highlighted, start down here, then it goes continued service, unscheduled, retrospective, and reconsideration. So we did talk about all of those things except for the retrospective requests. Retrospective requests are only applicable to those recipients that eligibility changed after you started services. So if they were a pending Medicaid recipient, for example, and you were treating them while they were pending Medicaid and possibly paying you cash for their services, once they are determined to be eligible for Medicaid, if it is determined that they are, that eligibility date can backdate up to 90 days. So you want to make sure that you are requesting that retrospective authorization within 90 days of that decision date. You can go back to the original eligibility date if you do that request within the 90 days from the decision date. So there's a lot of dates in there. So it's really important to follow this criteria. Make sure that you are reading up on this. There's also information about retrospective in the billing manual. And we're talking about we talked about the diagnosis codes. We didn't talk about referring NPIs. So referring providers are required to be listed on the claims themselves when you submit them. You do have to have a referring NPI. They do have to be actively enrolled with Medicaid. So that's important to make sure that you're including that. That was another high reason for claim denials, was that there was a referring NPI missing on the claim. When we talk about service limitations for services, you can refer out here to this link for what those NCCI edits or service limitations may be for Medicaid. They are also listed in your covered services grid, which we're going to get to here just a moment. So if you have a situation where you're billing 97153 and the limit is only supposed to be 32 units per day, but you're billing 40, you can find that information by clicking on this link here. It'll tell you what those limits are for the units per day. It'll tell you about correct coding if you should not report two services on the same day. So that information is what you can find here with this link. It's important to note that you are responsible for billing that correctly, making sure that your modifier combinations and codes are accurate and that your units of service are correct for that code. So if you haven't been out here to visit this page, I would definitely take a moment to go out there. There's a lot of helpful information. Here's your OPR requirements for your referring NPI. Here is your UD modifier requirements for specialties 312 and 314. That's going to be for your RBTs or registered behavior techs, or your BCABAs, your board certified assistant behavior analysis. So those services by those provider types and specialties must have the UD modifier on the claim to pay. If it doesn't, you're going to get some kind of denial. It'll say no pricing segment on file. And so that's what that means, is that that particular provider requires the UD modifier in order to pay for the services. You also have to have that UD modifier attached to that code on your PA. So it's important how all of these things tie in together, that you're making sure that you're submitting accurate data so it doesn't impact reimbursement later on. All right, so the next section here is our covered services grid. This is where you're going to find what your service limitations are, whether or not you have to get prior authorization for the service. So it starts out with your assessment codes. Assessments are one session of 16 units per 180 days. You also can have 97152 is one session of 4 units per 180 days. So technically you can get 5 hours, which the two of them combined, per 180 days for your assessment. If you needed to use both those codes, you could. So it's 4 units, or sorry, 16 units or 4 hours for your 97151, and then 4 units or 1 hour for 97152. So that's 5 hours total for your assessments or your reassessments. The next is all of your therapies. So this is your actual treatment, your one-to-one, your supervision, your group, and family. So here's your codes here. It does talk about the 40 hours per recipient per week combined, regardless of NPI. And it's for the following CPT codes, 0373T and 97153 through 158. So it carved out the 0362T and the 97151 and 152. So it's only for the service, the actual direct services that 40 hours applies. You can get that overridden if you have a complex or complicated recipient or situation with a complex diagnosis or behavior problems or patterns. You can request over 40 hours if it's medically justified on your FA11E form. You do have to make sure that you are justifying that in detail. If you have to attach extra sheets because your summary for the justification is long and lengthy, that's okay. Just make sure you're attaching that extra sheet to your FA11E form. So here's your individual treatments. This is for 97153. This does not list the UD modifier, but we talked about that already. If it's an RBT doing it or a BCABA, your PA and your claim must have the UD modifier attached to it. And then you've got your supervision, your complex treatment, your group and family codes. So there's only 8 total codes covered by the ABA for ABA services. And so it does say down here at the bottom that all session limits may be exceeded with prior authorization and documented medical necessity, which we just talked about for over 40 hours, but that could be for any, for example, you have a service limitation on 97156 of 4 units or 1 hour per calendar week. If you could justify medically why you needed to have additional units included over the 4, you could request a prior authorization with that medical justification for additional family treatment units. If you have a situation where you have a recipient coming to you from another agency and you're not sure if or when their last assessment was done with maybe the other agency, or maybe they're just brand new, and or maybe you don't even have any history on them at all until you're getting ready to do your own assessment, you can search for treatment history in the provider portal. I'm going to actually log in and show you because I think this is a super helpful tool. It's going to tell you when the last assessment was done for a patient so that you know if you need prior authorization for your own, because you only have to request that prior authorization for an assessment if that recipient had a previous assessment within a 180-day period. So if they're coming to you from another agency and their agency did their assessment in March, that would, and yours was today, you would have to request a prior authorization for that because it's less than that 180 days. So let me just log in here quickly and see if I can show you what that looks like. Oh, thank you, Ashley. That's great. So the PWP User Manual Chapter 9 does talk about how to check the treatment history. We'll just log in there quickly and see what that looks like so that you have an idea of how to check that if you haven't used it before. You know what, if you have, how about if I could get a raised hand if you've used the treatment history for checking for service limitations, assessments, etc. Victoria, thank you. Anybody else? All right, it looks like quite a few people are familiar with that process. So I'm just going to go ahead and just log in here again really quick just to show you, for those of you who are not using it, what a helpful tool it is. Thank you for everybody who responded to that. I appreciate it. Well, of course it has. Let me just update my password really quick. While we're waiting for this to log in, we're going to go ahead and do another engagement. We'll use the chat for the responses. So if this is going to be a true or false question, the UD modifier is only necessary on a claim. Is that true or false? You only have to put your UD modifier on your claim. All right, perfect. Everybody who's putting in false is absolutely correct. Okay. So here we have our homepage here. From your homepage, you're going to go over to claims. And in the claims sum menu, all the way down to the right is your treatment history search. And I can never get my mouse to work right. So I'll just click here and go this way. So you click on treatment history. You're going to put in your Medicaid recipient ID number. You do have to agree to the terms. And then you're going to put in your procedure code. So we do know that 97151 and 97152 have service limitations. We're just going to search for 97151. And I'm going to click, you can either put in a date range, so the previous 6 months, or you can click lifetime if you want to see all of them. That's what I usually do, just because this code is only every 180 days, so it shouldn't give too much data. If this person had had a 97151 anytime that they've been covered by Medicaid, it would give you the dates and the units down here. This person has not had it, so I know that I could do mine without having to request prior authorization. However, if I did see a date down here that was within the last 6 months, I would need to request that prior authorization, put it on your FA11E form as a request and indicate those units that you need and the date that the last assessment had happened. So it's important that if you're putting it on your form, you include the date, because it'll give you the date here when their last assessment was done. So the nurse knows not to cancel that line, not to cancel the service. She'll go ahead and review it for medical necessity. All right. So we're going to hop over to the slide deck again and talk about some of our forms and resources like we just talked about. So we have our FA11E with process type ABA for all PT85 services, including your unscheduled revisions. Your FA11F must be included with initial requests, and then any version of that form is acceptable if previously filled out by the diagnosing provider. Your FA29 is your data correction, clerical changes on an approved authorization, or termination of services to your own program. The FA29A is to terminate services for a different provider. It's to end date that authorization when the recipient's coming from another agency and their authorized services and dates overlap our request. And in your PT85 billing guides for covered services and service limitations, and your Medicaid Services Manual, Chapter 3700 for policy. So some of the key takeaways and important reminders that we've talked about today for enrollment and linking, all rendering providers must be enrolled, linked, and effective for the date of services prior to billing or submitting your claim. Linking and unlinking affiliated providers can be submitted as an update via the provider web portal. Verify provider linkage using the affiliated providers option. So I didn't show you that in the web portal. I'm logged in here currently. So if this provider was linked to, this is an individual, so if this provider was linked to a group, I could check what groups he was linked to by searching the affiliated providers option on the bottom of the left-hand side. You can also, as a group, if you're logged in as your group, you can see which providers are linked to you actively. So I always want to make sure that you're checking here to make sure that you have the dates going to cover the data service that you're billing for. So this is a super helpful tool, making sure you keep your roster up to date. If you see people out here who are no longer with your agency, that's when you're going to unlink them. and you would go directly into your update provider or revalidate provider option here. We didn't go through this before, so I'm just going to take you through it now. And you're going to submit an update provider. Oh, look, my guys do for revalidation. So your update provider is going to link or unlink individuals. If you just need to change your address, you can go ahead and click demographics. It would change your address right away. It would be immediate. You would see that change here as soon as you came back to this page after submitting. And then revalidation, I know we didn't talk about this and it's kind of jumping around a little bit, but this is kind of an important piece. Our PT85 providers are required to revalidate every 5 years. You can revalidate or start that process within 1 year of your revalidation due date. So because my providers due for revalidation within 365 days, 3/9/2027, I can go ahead and start that process now so I can make sure that I am revalidated and approved prior to my revalidation due date. Because if you don't, you're going to lose certain access to the portal. You won't be able to check eligibility or submit prior authorization requests. And since all services for ABA providers require prior authorization, that could be it could be a hardship for you. So I just want to make sure to point that out. Let me go back to my slide deck. So claims and billing, that's our next section. Your claim must match your prior authorization, including those modifiers. Adjustments and voids are only allowed on a claim in paid status. Denied claims should be resubmitted as a new claim and do not try to adjust a denied claim. Service limitations can be verified using treatment history. And then authorizations, the initial request must include your FA11E and F and an IEP if applicable. Continued service requests should be submitted prior to the last authorized date on an FA11E form. And your FA11F must be signed by the diagnosing provider and must be an approved provider per MSM 3700 and the FA11F form. There are specific providers who are approved to diagnose a individual, and that those provider types are listed at the top of the form and also in policy. Okay, so that is my presentation for today. Before I have Ashley launch our final survey, I do want to ask you one more engagement question, and we're going to use Slido. So Ashley, if you wouldn't mind launching the last Slido survey question.
Absolutely. It should be launched now, so hopefully you can see it displayed in the WebEx, but this is going to be another free answer question. So this is in relation to the resources that we have gone over today. So what is one resource you will use after leaving here today? And you can answer directly into the Slido or in the chat.
And it's also okay if you submit more than one answer. That's perfectly acceptable also. So thank you so much for those who have responded already. It's great to see that some of the stuff that we talked about today is going to be helpful for you. And I'm not sure, I don't think I missed any questions that were in the chat, either Ashley or I think grabbed those. Ashley, is there anything that I missed possibly?
Nope,
Okay,
nothing new in the chat.
great. We'll leave this open for just another minute or two while we wait for people to continue putting things in here. This is great. Looks like there's a lot of resources that you guys picked up on. It's quite a bit of responses, so thank you so much. We do have a question in here from Tristan. Can you go over the rate change of 13 to 15 per unit? That was just an example, Tristan. It did not affect ABA providers. So that didn't actually happen for ABA at this time anyways. So that was for a different behavioral health provider type. The example I gave you was just an example. And it looks like we have Danielle. Yes, if you want to hang out, we can certainly go over your questions after. Ashley, I'm going to go ahead and ask you to shut down Slido now and then launch the final provider survey. I'm going to actually stop sharing now. Okay, perfect. So if you want to launch that last survey, that is a short survey with just a couple of questions. If you could please take a moment to fill that out. It does let us know how we did today and any future trainings you might be interested in attending or seeing. So if you could answer that before you leave. Once you're done there, if you don't have any questions that you want to hang out for and ask, then you're welcome to go ahead and drop off the call. Again, I want to thank everybody for their participation today. It was great engagement. I do appreciate all of the feedback. So you can go ahead and drop off the call when you're done. Have a great rest of the afternoon and have a great rest of the week.
Hi, Susan, it's
Yes.
Lele.
Hi, Lily.
Um, I was I I don't know if there are other people on the call still. I have a I have a specific question to my company when it's kind of like sensitive.
Okay, we
Um,
probably don't want to talk about it on this call unless if you can remove
no,
any PHI or PII.
mm, I don't know what that means.
That
What
just
is?
like don't talk about specific
Oh,
providers' names or recipient
oh, no,
names.
no, no, yeah.
Okay.
It's I'm in a I'm in a payment hold with claims, and I've been reaching out and waiting to hear back from finance. And
Okay,
I'm
let's
just,
probably
yeah,
let's go ahead and table that one, Lily. I can get a hold of you
thank
after
you.
this after the
Sorry.
meeting. Yeah.
It's
No, no,
okay.
no, no. That's great. Thank you for asking. I will reach out to you afterwards.
Okay, thank you.
Sure.
Thanks,
And Vic,
Susan. I work with LA, so that's covered
okay.
if you're going to reach out. Thank you so much for all your
Thank you,
help.
Danielle. Yes, you're very welcome. It looks like Victoria, you have your hand raised. You can come off mute and ask your question if you'd like. Okay, and we do have some new questions that came in through the chat. Christina asks, what is the oldest FA11F that we can submit? There is no date frame on what's the oldest one you can submit. If you have a completed one, you can go ahead and use that form because the diagnosis is only required once per Medicaid guidelines. So you would have to just modify by adding either the recipient's name, page number, date of request on any additional pages, or page one if it's not currently there. Okay, so that's something that we probably need to look into a little bit further, Christina. If you've had it denied previously, we can get together, or if you want to shoot me the authorization number via email, I can put my email in the chat so you have that if you don't have it already. Okay, there you go. If you could just email me that prior authorization number, I can take a look at that and respond back to you. Let's see, Nicolette, looks like you have a question about a webinar to provide MCO information. I don't have information regarding the MCOs and how they manage their presentations or their webinars. So if you wanted to reach out to the MCO directly, you would have to reach out to the ones that you're interested in to see what kind of training opportunities they have for their program. And then Victoria wants to know if we can access this recording of the presentation, or will there be another one for another staff member to attend? As I mentioned before at the very beginning, we may be able to post this one to our YouTube training page and to the LMS Absorb training registration website. It has to go through modifications and some approvals, but we can see about getting this one posted out there so somebody else can listen to it. Great questions, you guys. Thank you so much for participating. It really means a lot to me to have everybody here.
Hey, Susan.
Yes.
It's Ashley. I think just to answer Christy's question, you do need to make sure you or the recipients, whoever, are using the most current version of the form that's posted on our website. I think that was the question. If the form was outdated itself. For the 11F, it was most recently updated June 10th of 2025. So any requests, I would make sure are on that most current form.
So let me just elaborate on that a little bit because this has come up several times before for our ABF providers. So if you have an old version of an FA11F that is signed by the diagnosing provider, and you submit that with the appropriate documentation or medical record documentation requirements, like I mentioned, having the name and the date of request and the ID number, page number on all pages that it's associated with that FA11F, that form is acceptable. You do not have to go out and get a new diagnosis on the new form. The only time you need to use the new current form on the website is if you have a brand new recipient who has never been diagnosed with autism before, with ASD. So that's the only time you have to use that brand new FA11F. If you have somebody who's been diagnosed for a while, use that old version. That's okay. Just make sure it's following the criteria for the medical documentation requirements. Thank you, Victoria, for your response. That's much appreciated. Christina, if you continue to have issues on getting denials with the older version of the FA11F, you can always reach out to me at my email address. And I need examples to look at, of course, but would be happy to work with you to see what we can do to get those, to get clarification for you on that. Perfect. That sounds perfect. I will look for that email.
Hi, Susan.
Hi.
Hi, good afternoon. This is Nicolette.
Yes.
I had a question. How long would it take the system to show a provider as effective once it's linked to our group?
So once the linkage is approved, you should be able to see that linkage in your affiliated providers option in the portal immediately. So it should show you the linkage effective date, but once it's been approved and you get that linkage notice, you should see them out there in that list.
Okay, because I have some claims that were being denied as the provider not being part or linked to our group.
Mhm.
And when I look at the information, everything shows the effective date, everything shows active. But once I resubmit the claims, then we're getting like a timely filing denial. So I just wanted to know if there was any lag or delay on that
So
linkage.
in that situation, it's usually because of the date that the provider was actually added to the system. So depending on when you submitted the request and how far back you requested the linkage date, that could
Mm-hmm.
be causing an issue. Maybe the claim was billed before it was actually updated in the system. Because the effective date that you're going to see in your associated providers option in the portal is going to be the date that you requested that service or that provider to be affiliated. So if you submit the request today, that's going to be the automatic date, unless if it's a new provider, then you can designate that date. But if it's just somebody who's already enrolled and you're just linking them, that
Mm-hmm.
effective date is going to be the date that you submit that request. So
Okay.
it just depends on when it's updated in the system. If you have specific scenarios where you want me to look at a NPI or a claim that has that
Mm-hmm.
type of denial, please do send me an email and I will look into that for you. That's not a problem.
Okay, perfect.
Okay.
Thank you.
Thank you for asking. That's a great question. All right, we'll give it another minute or so. It looks like we have quite a few people that have dropped off the call already. So just another minute or so to complete that survey, decide if you have any questions that you want to ask, and then we're going to end the call. So thank you again for everybody who participated and all great questions. I appreciate that so much.
Thanks so much.
Thank you. Have a great rest of the day, Danielle.
You too. Bye.
Bye-bye.